Circulation énergétique. Je vais utiliser le petit râteau donc au niveau du front. Donc on me dit au niveau de la tension, est-ce que ça vous convient, si ça ne fait pas trop mal?
Non, c'est parfait.
Au contraire, donc voilà. Donc là on va détendre un petit peu au niveau du front toutes les tensions que vous pouvez avoir accumulées dans la journée et dans les semaines précédentes. Donc là je passe au niveau de votre cuir chevelu, donc j'active la microcirculation cérébrale. Je vais rayer le visage, c'est-à-dire que je vais passer donc sur les différentes lignes pour la circulation énergétique.
On dirait des gouttes d'eau qui tombent sur mon visage.
Il y a de la fatigue aussi chez vous?
Oui.
Beaucoup?
Très, oui.
D'accord. Donc là, je reste un petit peu, je prends un autre point, toujours.
Là aussi, oui.
Pareil. Hein. Côté. Oui,
Là aussi.
je vois. Donc là, on travaille justement pour relancer au niveau de la souplesse et puis la circulation du chi, hein, parce que ça stagne souvent aux extrémités. Donc là, ça va plus s'assouplir et on va dire faire circuler l'énergie dans les mains pour que vous puissiez travailler d'une meilleure manière. Vous ressentez les petites choses là?
Ça, dans le bras et tout, c'est bien.
Ça circule.
Ouais. C'est très rapide.
Ben, de toutes les manières, c'est un côté yang, hein, donc la corne qui fait que justement vous avez vu les petits picots, donc qui font que ça fait stimuler un petit peu le...
Thì các bạn cũng biết rồi, con trai út trong mấy thứ ba. Thế thì vận dụng tất cả những nguyên lực về âm dương đó, hồi nãy Lương nói đó, thì các bạn nào mà đã học viện chẩn của thầy Châu rồi đó thì biết những cái gọi là nguyên lực về âm dương.
And I'm going to take you forwards. Yeah. And now I'm going to take the whole of your body backwards, the whole of you from your hips. And now I'm going to take all of you forwards. And I'm going to take all of you back. And now you're staying very still in your neck and back. And all I want now from you, and this isn't easy, but I want you to just stand up with your heels. Yes, that's it. Stand up now. That's it. And bend the knees. All the way to the stool, and then stand up again. Heels. And bend the knees. The reason I say heels rather than stand up by itself is because most people stand up by pushing with the toes, and they often forget about the heels. So I want you to remember you've got all of your feet on the floor, and all of it's going to be used. Hips back and bend the knees again. And then stand up with your heels again. That's it. And then bend the knees. And then heels again. Wouldn't do you any good. So let me move you forwards and stop. Let me move you backwards. So what's your sensation around your face, neck and jaw right now as you're sitting and standing and moving?
I don't feel much, to be fair. I don't feel any tension or pain.
Right. So you can feel it's a bit softer around this area already?
Yeah.
And then heels into the ground. That's it. Good. You can stand up now. And I'll take you back. And now the same thing here. I'm going to take an arm. I've got the weight of your arm. What do you spend most of the day doing? Do you sit at a computer screen all
No,
day?
it really depends. I'm spending quite often. Computer as well.
Yeah.
And running around.
I mean stressfully running around, or just...
Yeah, sometimes, yeah.
As in rushing around?
Yeah, rushing around, yeah.
So you can see, even though my hands are here and I'm moving you over here, your neck isn't getting involved, is it?
Thoracic cage configuration, you want to make sure that when she breathes, it's symmetric, not one side is coming out far. Spine is processed. You can check this while the patient's sitting here. Have them lean forward just a little bit. Looks good. Good. Can you actually bring your both legs out for me? Very good. And then the other one. Good. And that again assesses the range of motion.
Der NMP-Pediküre-Strumpf wird sorgfältig angezogen und die Nägel kurz einmassiert. Das wird der Reihe nach an allen Nägeln durchgeführt. Das Keratin in dem NMP-Pediküre-Strumpf verhindert Nagelbrüche und Risse und fördert somit das gesündere Wachsen der Nägel. Der Strumpf wird an der Fußspitze geöffnet und hochgeschoben. Die überschüssige
Then it has a greater likelihood ratio of predicting greater sensitivity and specificity of predicting peripheral vascular disease than the ankle arm index. So that's what we do, and it's just important, no matter what abnormal finding you find on physical exam, you're thinking about protein, fats, carbohydrates, the many different minerals, vitamins, and phytonutrients that all play a role in peripheral vascular health.
Now let me just compare hands. So yeah, we can see the same kind of ridging here. And the same flexibility in some of the nails in the absence of the lunula. Your hands are a little on the cold side. Do they tend to run cold? If I check your capillary refill by just pressing down on the nail bed until it lightens and then releasing, it's a little bit slow. So we're going to recommend some things to warm you up. The nail strength also can give us insight to our protein status. Look for nice strong nails that aren't readily bendable. You can see that a couple of your nails are perhaps a little bit more flexible than I would like to see. So this really suggests to me that we want to do some more protein. Tell me what you had for breakfast today.
I had crackers and cheese.
Crackers and cheese. So you had a little bit of protein, probably more fat, but so we'll look at it closely and see what you're taking in. Now I'm looking at the texture of the nails. You can see on the thumb, if you run your finger over it, you can feel these vertical ridges. You can see them and you can actually feel them a little bit. Very mild. Vertical ridging is present in most of us, particularly as we get older. But
measure her hands from here. If I measure her hands from here to here, her hands are long and her fingers are shorter, but they look longer because they thin out at the top, and she has her nails on. And she's used an oval on her French tip so that that oval lets your eye continue to go up rather than having blunt across here that stop your eye travel. Our eyes always go where we lead them to go, and Shearston's fingers, because they narrow down here and because of the way her nail tips are, they allow our eyes to travel up, and that's why she probably
See? Yes. And what I'm massaging here, this area here. Is that okay, Joe? Yeah. So look, I'm just following his. There's no force there. Yeah, then I can. Yeah. That feels comfortable, isn't it? Yeah. Make sure to keep your structure.
And I'm going to assess your scalp, so I'm going to make sure there's no lumps, bumps, and then I'm also going to look for any lesions or infestations. So all that looks good. Okay. Any pain there? Oh, right there. Okay. So I'm going to palpate. If you have any pain. No. Okay. Turn your head. I'm going to assess for any excessive earwax. I'm going to go ahead and look into your ears. Now, no problems on the left. I'm going to palpate the lateral, pectoral, central, and subscapular. So I'm not able to palpate any of those, so that's all.
Now, follow the pen light with your eyes, not with your head. Perfect. So I'm going to check your ears if you face this way for me. Okay, face that way for me. Good. Okay. Okay, you can look up front now. And does this feel the same?
Mm-hmm.
Perfect. Can you lift your eyebrows for me? Smile. Puff your cheeks. Now open your mouth. I'm going to check inside. You can say ah. Stick out your tongue. Perfect. Clench your jaw. Any pain?
No.
No? Checking your neck. Neck looks fine. Now I'm going to check your side, your arms. Okay, does this feel the same?
Yes.
Does this feel the same?
Mm-hmm.
I'm going to check your radial pulse. Looks like it's regular and they're the same. Can you squeeze both fingers for me? Can you push and pull? Perfect. Thank you. I'm going to check
Skin turgor, so I'm just going to give you a little pinch. Normal skin turgor snaps back rapidly. And I'm going to check your capillary refill. Less than 3 seconds. I'm going to take this off. And less than 3 seconds on both feet. Active in all 4 quadrants. Any tenderness? I'm going to go a little deeper. No tenderness or masses noted. Alright, if you'll stand up for me, I'm going to assess your spine. Turn this way. And bend over. Touch your toes. No scoliosis, lordosis, no.
3 पार्ट में डिवाइड कर दिया स्पाइन को. जो बाहरी सरफेस है यानी 8, 9, 10, 11 इसमें हमने चाइनीज स्पाइन को यहाँ पर इमेजिन किया जाता है. चाइनीज स्पाइन को यानी चाइनीज स्पाइन को पूरा यहाँ इमेजिन कर लिया है उन्होंने. जो फर्स्ट पार्ट है जिसको बोलते हैं EH8 इसमें उन्होंने C1 से लेके C4 को इमेजिन किया है. जो सेकंड पार्ट है EH2.
Hello, this is an oral mechanism exam for speech-language pathology. The first thing I'm going to do is I'm going to use my antibacterial wipes and wipe down our surface. After I do that, I'm going to have our patient sign her consent form so that we have permission to do whatever needs to be done today. While she does that, I'm going to wash my hands really nicely so that I don't give her any of my germs that are on my hands. Thank you. Okay, to start today, I'm just going to have you look straight at me. Awesome, thank you. Now, can you purse your lips for me like you're giving a kiss? Good. Now smile pretty. Now say ah, ah, ooh, ooh, ee. Awesome, thank you. Deep inside your mouth. All right, say ah, ah. Perfect. Now when I do this, I can see down in there and I can see your tonsils. They look great, and I can see your uvula. And now I'm looking at your hard palate and your soft palate, and everything's looking good in there. For any facial hair, her hair is appropriate for her gender. Yep. So I'm going to check her terrier. No tenting noted. I'll check your cap refill. It looks like it's going to be less than 3 seconds. Her nails look strong. They don't look weak or feel weak. Can you put your nails together and look for a diamond? No clubbing. Good sign. So I'm going to have you just open your mouth. Alright, and then I'm going to have you close your eyes and tell me where I touch you. Right cheek, left cheek, chin, forehead. Alright, cranial nerve 5 is in ocular, occipital, then the tonsillar one, submandible, and then the, what is this one again? Submental. Now we'll do the anterior and the posterior. Cervical, supraclavicular, and then the infraclavicular. Alright, I'll get your landmarks. So I see the, the tragus, antitragus, helix, and then the anti-helix.
So the scene is considered safe. I'm wearing the correct PPE, which is gloves and glasses. So I'm just going to introduce myself to the patient. Hi, my name's Aisha. I'm from New South Wales Ambulance. What's your name?
Mahela.
Mahela, nice to meet you, Mahela.
You too.
So I'm just going to explain the procedure to the patient. So today I'm going to be performing an abdominal assessment on you. It's just going to involve me listening and touching. Is that alright? Yeah. Yeah, that's fine. Okay, and you're in a position of comfort? Yeah. Yeah, and the patient is laying supine, which is optimal. So now I'm just going to expose the patient's abdomen, maintaining patient modesty. So then I'm just going to be visually inspecting the abdomen, looking for any scars, feeding tubes, anything like that. What else? Pulsatile masses, stomas. I'm not finding anything like that. And so are you in any particular pain? Is there a spot at all?
Not any certain spot.
No? Okay. If there was, I would just get them to use one finger and point to it to localise it. So now I'm just going to auscultate the area. So I'm just going to use my stethoscope to listen. Is that alright?
Yeah, that's fine.
Yeah, I'll just be listening in the 4 quadrants. Alrighty, might be a bit cold. That's okay. Perfect. Okay, now I'm just going to percuss the abdomen in the 4 same quadrants. Is that alright with you?
Yeah, that's fine.
Yeah. Perfect. I'm not hearing any fluids or anything there. So now I'm just going to palpate the abdomen. So just let me know if you're feeling any tenderness or anything. Yeah. Any tenderness?
No.
No pain or anything?
No.
No? Okay. And there's no guarding that I can see. And now I'm just going to assess for referred pain. So are you feeling any pain in your shoulder?
No.
No? What about your chest?
No.
No? And what about your groin?
No.
No? Not anywhere else?
No.
No? Perfect. Alright. So now I'm just going to explain the findings to the patient. So I have listened, percussed, palpated. I'm not finding any areas for concern. So you're all good.
Thank you.
Through the hair, looking for even distribution. Yeah, and also if you like just looking out for the thickness of the hair, feeling the texture. Yeah, that's pretty good. you have healthy hair.
Thank you.
I'm also just going to be looking out for any lesions, so any bugs or like lice or ticks, just to make sure your hair is healthy, and it seems to be, yeah, everything's fine. You got some good hair. So I'm also gonna note, so you do have dye in your hair. This is not your natural color, and that's perfectly fine, but I just have to make a note that you do have chemicals in your hair. Okay. So assessment. Moving on to your nails. So your nails are a nice length, I can see that. They seem to be thick enough, so just asking, do your nails go to a certain length and just break off?
No.
No, so they're not thin or anything. Yeah, they seem fine. And just asking, do you get your any acrylic nails done?
No, I don't.
Okay, just saying because that is a source of like fungal infection and it's not good for our nails. So that's pretty good. Everything seems to be fine. So it's just the dryness, which is our concern, and that probably could be fixed if we.
Now I'm going to feel for pain or tenderness. Let me know if you feel any pain.
Okay.
Alright, and there's no lumps or masses. And there was no report of pain. Can you sit up here for me? I'm going to listen to your breath sound. First I'll be checking her anterior bronchosvesicular sounds. Each time I place this on you, just take a deep breath in and out, okay?
Okay.
Is symmetrical. Cap refill on the left hand is less than 3 seconds. Cap refill on the right hand is less than 3 seconds. Temperature is also warm on both arms. Alright, now I'm going to feel for your brachial pulses. Alright, they're even and bilateral and rated out of 2+. And now I'm going to feel for your radial pulses. Her toes are a bit cold, is that normal?
Yes.
Okay. I'm going to check for your capillary refill. Alright. You can have a finger. Thank you. Now I'm going to take your temperature. Thank you. Temperature is 98.4. Alright, so now I'm going to feel for any lymph nodes, okay?
Okay.
Alright, no lymph nodes present. And now I'm going to feel your carotid. Alright, can you squeeze my fingers as hard as you can? Alright, and can you pull my hand? Alright, and push. Alright, thank you. Strength is
Good, good. Okay, I'm going to start from back here. I'm going to check your preauricular nodes. Right in front of your ear. I'm going to move to your postauricular nodes right behind your ear. And I'm going to sneak right behind your head to your occipital nodes. I'm going to give you a little massage here to your scalp. Good. Oh, and I'm going to go down through your neck area. Just going to check your buccal muscle, your buccal meter here. Check your jaw. I'm going to check your submandibular nodes here. Make sure there's not any obvious areas or sores. Okay, I'm going to press on your tongue just a bit. Can you say ah?
Ah.
Good. I'm going to look at your uvula and your palatal-glossal arch and your lingual. Can I have you stick your tongue out at me? Perfect. And take a look here. I'm going to check the lateral border of your tongue. Very good. I'm going to check the right side as well. I'm going to palpate. Very good. And
les articulations. Le toucher est un moyen de pénétration de la psyché. Il amène le patient à avoir une meilleure conscience de lui-même. Les cervicales jusqu'à la structure occipitale. Je vais commencer maintenant à traiter chaque orteil. Je fais le tour de la suture occipitale au niveau du gros orteil. Et puis, chaque suture de chaque orteil, toujours en pression-rotation. Suture occipitale, du 1er au 5e orteil. Et la pratique de la réflexologie plantaire requiert donc une connaissance parfaite de l'anatomie et de la physiologie du corps humain. De haut vers le bas. Dans la zone mentale, je vais travailler le plexus pinéal ou épiphysaire, puis le plexus hypophysaire ou pituitaire. Puis, dans la zone émotionnelle, le plexus thyroïdien, le plexus cardiaque.
Hi, Nicole. I'm Dr. Kara Fitzgerald, and I'm going to be looking at your nails, your fingernails, and your toenails. Nails actually can tell us quite a bit about our state of health. So let's take a look at yours and see what we see. First, I'm going to look at the shape, and you can see yours are a lovely curvilinear shape. Nice shape to the nail plate here. Look at the color. They're pink. I see you have a nice cuticle. And at the base of the nail, we see
So the first thing we start off with is just trying to relax the client. And we do that with a just nice little head rub. Then I will take the rake, and this rake I will stroke through Tina's hair and scalp particularly, as it rebalances and re-energizes and relaxes the client. I will do that for about 3 to 4 minutes. Thereafter, I will press some points on Tina's face that really make her relax and de-stress. Now I have taken a look at Tina's face, and there's not so much going on. There's a little bit of blemishes here, which is the lung system in that. Otherwise not too much is showing up. So I will just palpitate her face and see if I find any imbalances. I'm feeling a little bit here under the eyebrow or above the eyebrow. Tina, do you have sore shoulders and neck?
Yeah, I do sometimes.
Yeah. So this is what I'm picking up. Different tools do different things, and a lot of people have a double chin, and just by working under here, it will help tighten the skin. It's improving lymph and blood circulation and detoxifying at the same time. And work with her jaw, again as a tightening effect.